Now onto the stretcher. Here we have a naked stretcher. We have a black mattress on the stretcher here itself. It's not as comfortable as some people would like, but it is a mattress. To clean the mattress, you want to use a calcicide solution and leave it on there for no more or no less than 90 seconds. From there, you can apply clean sheets. We'll get to that in a minute. So starting here at the side, we're going to start with this side rail. You can apply the side rail up and down. It keeps the patient secure. You can lift it up. You push the red lever to let it down. And then we're going to leave it down. Moving on down, we have the IV pull. The IV pull is to release it. Of course, you want to apply some pressure to lift it up. Squeeze on where this little black lever is, and then lift up. It goes up about 2.5 feet tall. From there, you can hang your fluids. If you've got multiple bags of fluids or other medications, you can hang it from this side as well. To lower it, you want to twist down here and release it. There is a metal piece here. You want to apply pressure and let it in, push it down. And you want to lift up and secure it back down in this spot. There are 2 of these, one on either side of the stretcher. Down at the foot, you have 2 red levers here at the feet. These levers allow you to maneuver the stretcher in an upward and downward motion, or downward to an upward motion. With gentle pressure applied here and picking up in an upward motion, with someone on the other end, you can pick the stretcher up and down. Here at the feet, you have 2 Velcro straps and a metal slot where you can put your O2. A D cylinder and E cylinder will fit in this place appropriately, and you can use the Velcro to secure it into place. Here at the bottom of the bed, you also have a lever that you can lift upwards. Using this, you can place a patient in trim Dillenberg. And to release this, you just apply an upward motion, upward pressure, to this lever here, and it allows the bed to go back down to a supine position. Moving on to this side over here, well, here at the foot, sorry, we have another bar. It is the pull bar, so if you're leading the stretcher at the foot of the bed, you can use this bar to gently and easily pull the patient down this hallway or down the hallway. Here on the other side, you've got more straps, and we will put those on in a few moments. And you've got your other bar. Make sure that whenever you're putting a patient in the back of the ambulance, where you see these little red marks that say do not put hands under here, these will get your fingers pinched. Back here on the back towards the head of the bed, we have a lever, a little red lever here underneath, that you can apply pressure to, and it raises the head of the bed to a 90-degree angle. This is called a Fowler's position, when a patient is sitting upright at a 90-degree angle with their legs up, 90-degree Fowler's. You can put a patient in semi-Fowler's position, or you can have them in a prone position. That's a supine position. Normally, you don't want your patients to be in a prone position on a stretcher. So we're going to lift this back up to a 90-degree angle. We also have the securing bar at the head of the bed here. This allows you to put the stretcher into the ambulance and secure the locks, not allowing the stretcher to roll back out of the ambulance. Where the red places are on this bar, you do not want to put your fingers whenever someone's lifting it in there. It will mash your fingers. This red bar underneath, this vinyl mesh here, you can use it to lay your supplies on, or your jump bag, your monitor, whatever you need at the time. It's just a place for you to place your belongings. The red bar under here allows this part of the stretcher to fold down, allowing the bed to be at a 90-degree angle, flush. This way you can maneuver around decks and small confined spaces, and the patient's not able to walk. It's very handy to put it back into normal position. Of course, you've got it down in this position. All you have to do is apply the upward motion, and it locks. When you hear that pop, it means it's locked. Alright, these upward wheels, whenever you're putting the stretcher into the back of the ambulance, loading it in, you'll have these large wheels that will allow you to maneuver into the ambulance. The lower wheels down here on the bottom allow you to roll across the floor. There are locks down here. This bed's in a locked position at the moment. They are on the bottom right and left wheels, which allows you to lock the stretcher if you're going uphill or downhill and you don't want your bed to roll away. You can put them in a locked position as pushed down, or an upward position is unlocked. Alright. Points that you do not want to put your fingers, if you'll follow me here. You do not want to put your fingers here, here. If you have an unloaded stretcher, meaning a patient is not on the stretcher, and you're having to lower the stretcher to help a patient onto it, or you're having to maneuver it for something else, you can put your foot on the bottom bar and your hand here on usually your right hand. Pick up and lower the bed. Now you have a bed where you can put a patient sitting down where they can sit down and sit in position. To lift it back up, put your foot there, and in a upward motion, or pull in on the bar, lift up, applying pressure with your foot. Do not do this with a patient on your stretcher. Always use a two-person, one on the upper end, one on the foot end, to lift the stretcher up and down. To make a bed, we'll have my assistant here give me a hand. So this is the head of the bed, and that is the foot of the bed. To properly make a bed, you want to take your sheet and lie it flat down on the bed. You'll take either end of it and tuck it under. That way it's easy to put in. You want to lift to the right hand side, or your partner's left hand side. And lift the opposite side, make sure that all corners are all tucked in properly. You'll also take a pillowcase. I always like to lie my pillowcases down flat with their pillowcases on them, and a sheet or a blanket, and you want to take your straps here that go across the center of a patient's stomach or abdomen, and you want to lock them into place. Pull that tension down tight. You want to take this excess that you have here, double it over and double it over again, tucking it under. This makes a presentable strap. Same for the foot strap down here. Double over, underneath. Up here on the head of the bed, you have a 4-point harness that allows you to secure a patient better than it would be with just the abdomen and foot strap. These straps are particularly used in combative patients, or patients that you have a worry that they're going to fall over, maybe patients who had a stroke, or someone that you're concerned that they may fall over to one side more so than the other. So you've got these 4 parts. You've got the 2 parts that go across their chest and over their shoulders and across their chest, and secure here in the middle. You want to take your seat belt and go through the metal clips and secure in the seat belt part. You can tighten on either end. You can tighten over the shoulders. You just want to make sure that you give the patient enough room, that you're not strapping them down so hard that they can't breathe, or make them hurt worse if they're having any chest pain or anything of that matter. Alright, now that we've done this, we're going to properly load it into the back of the ambulance.